And equally important perspective is our second civil society speaker. I'm very pleased to welcome Cristina von Sperling Afridi, who is speaking to us from the Karim Khan Afridi Welfare Foundation in Pakistan. Cristina, I see you there. Lovely to see you again. Thank you again for joining us.
Hello, Jimmy.
Hello, and over to you. Over to you.
Thank you. Thank you. Hello, Jimmy and Mirella, dear colleagues and panelists and participants. Good afternoon. I would like to thank Vienna NGO committee for giving us this opportunity to share our views on the World Drug Report 2022, the impact of cannabis legalization. So about us, since 2015, KKAWF has been working to empower the youth with awareness, knowledge, and life skills that will enable them to avoid the drug addiction trap. We work to equip students with knowledge and awareness to break taboos through prevention education. Our work rests on 5 pillars to build protective factors for youth and engage with them to make healthy life choices and better identify, understand, and manage emotions. We have the drug awareness primarily. We have environment, sports, arts and culture, and civic sense. These are our pillars. So about KKAWF, we use the valuable information and data presented in an annual World Drug Report in its youth prevention education program. It's also used the findings of the report in its policy advocacy activities to promote action to address the challenge of drug use in Pakistan. It promotes the findings of the World Drug Report with various media outlets through writing articles in print media, news coverages of its commemoration of international days related to drugs, and post and social media platform. So we need to monitor cannabis legalization. So drugs, the most destructive element in society, yet the world is witnessing an ever-increasing expansion in variety, availability, and use of drugs, unmatched in previous generation. Cannabis remained the most widely used drug globally. 209 million people used cannabis in 2020, representing 4% of global population. Markets for these drugs are expanding to more vulnerable regions. More and more youth are turning to drugs. 284 million people aged 15 to 64 used drugs worldwide in 2020, a 26% increase over the previous decade. The undeniable social and economic cost of drug use not only hinders sustainable development, but take an emotional toll, stealing the future of its young population and the future of every nation. Cannabis remained the most widely used drug in Pakistan with an estimate of 4 million users. UNODC survey in 2013 stated that Pakistan had 6.7 million drug users with 4 million addicts. Current unofficial estimates show over 9 million users, which represent the highest number worldwide. The survey, no survey since then. Apparently, they are going to start one this year, so 10 years later. So there can be no effective prevention or treatment without recognition of the problem and the necessary funding to address it. In 2020, Pakistan approved the legalization of hemp production for industrial and medicinal purposes. No regulatory framework was set up to monitor implementation, thereby increasing risk of its use for non-medical purpose. Without mechanism for accountability of such policies, cannabis use could further escalate. Drugs in Pakistan are cheaper than food. Due to easy and cheap access, Pakistan has a transit corridor for trafficking from neighboring Afghanistan, producer of 85% of the world's opium in 2021, is victim to the escalating use of drugs. taking the greatest toll on the young population. More youth taking to drugs, 9-year-old children falling prey to deception about drugs. With 130 million youth under 30, the second youngest population in the world today, it is imperative for Pakistan to have a response to drugs, especially cannabis, that puts stronger focus on prevention programs. Young people continue to use more drugs than adults. So we need to monitor cannabis legalization in Pakistan. So a growing population, stigma, absence of drug education within the family and its in education institutions, lack of a stronger national narrative to say that drugs are wrong is fueling the drug menace. Education institutions are now the hub for drug use. In face of this multiple crises, we need to take greater care. Care starts with evidence-based prevention and addressing perception and misperceptions of risk. Role of civil society in partnership with governments is a crucial in spreading programs highlighting prevention in schools. So impacts of cannabis legalization or trends indicates cannabis legalization has had a wide-ranging, worrisome impact on public health and safety, market dynamics, commercial interest, and the criminal justice system. 2020 saw an 80% increase in cannabis users from past year, while the number of people using it increased by 23%. From 2019 to 2021, cannabis had broken all records of selling worldwide through the darknet, especially during the pandemic. So seizures of cannabis resin increased to a record of 2020. Seizures of cannabis herb increased substantially in 2020. Countries have not so far proved the benefit of legalization, yet it remains the most widely used drug worldwide. More harm can be caused as compared to unexpected benefits. Cannabis is the most popular drug, accounting for 48% of all drugs sold in value terms globally. Even in Pakistan, cannabis has always been a popular recreational drug among the youth in rural and urban areas. Legalization without regulation and evidence is promoting the glamorization of cannabis and romanticizing the product to lure the vulnerable youth to make profits with no interest to consequences of addiction. Companies which are involved in stimulating this market are subverting the reality for the purpose of profiteering. An international unified narrative highlighting plans to manage increasing public health concern due to cannabis legalization is urgent. Increases have been evidenced in the use of cannabis in terms of potency, amount, use, and frequency of the use in 2020. Cannabis accounts for a substantial share of the global drug-related harm, owing to its high prevalence rates. Simultaneous quadruple confluence of increase in intensity, potency, plus frequency of use, THC content of cannabis products, hospitalizations have all likely interacted to push the upwards trajectory of its use. Some 40% of countries reported cannabis as the drug associated with the greatest number of drug use disorders, and 33% reported it as the main drug of concern for those in drug treatment. So this is a clear long-term trend of increasing THC content in seized cannabis herbs in Europe and the United States. Average THC content of cannabis herbs seized in Europe has increased by almost 40% since 2009, and that of cannabis resin has tripled. In the non-medical use of cannabis, most cannabis products now have THC contents greater than 20%, and cannabis concentrates have THC content up to 70%. Rising THC is and failing CBD levels in cannabis amplify health risks, A higher ratio of THC can increase dependency and the chance of psychiatric comorbidities. So perception on cannabis harm. UNODC research has shown that perception of cannabis has decreased in areas where the drug has been legalized. At the same time, the proportion of people with psychiatric disorders and suicides associated with regular cannabis use has increased, together with the number of hospitalizations. So countries, we believe, need to be held accountable for their policies of liberalization. They must share the responsibility of the addiction and loss of precious life around the world. So way forward, taking action, United Nations agents must prioritize and promote civil society as a soft power to play its effective role against the harm that cannabis and other drugs are having. They must, along with governments, support civil society through financial and policy provision to widely implement prevention. Civil society organization is a powerful voice to take this message to the grassroots level. International civil society needs to come closer to build an alliance to evaluate trends and pursue a solution amplifying the call for prevention. We must use the wealth of information presented in the World Drug Report each year to counter the growing drug problem. The relevance of knowing the number that have increased and harm that is skyrocketing is valuable. Only if accountability is done and needed results are delivered. We need a closer and stronger global coordination to combat this scourge. Impact of cannabis legalization should be evaluated, consequences explicitly spoken and responsibilities identified. Governments should be sharing best practice and civil society organizations should be implemented. Countries need to take full responsibility of legalization impacts as consequences do not remain within the country's border. It becomes a bad example and influence other countries' related decisions. Plans for meeting drug-related SDG targets need urgent attention and action. We need the World Health Organization to continue strongly playing a constructive role for the world free of drugs. Final thoughts, prevention is the only way forward. Need to make youth aware of the dangers of drugs. When prevention grows, traffic is less successful. Prevention for the protection is the only solution for the youth to build up a mechanism of self-defense. We must stop the normalization of drugs. No drugs, no addiction. Thank you.
Thank you, Christine. And and I just want to say again, thank you to all of our speakers, Angela, Cameron, but also Pedro and Christina. I think it's been a really interesting session so far. Loads of questions have come in and I've seen Angela and Cameron have been very busy.